Hey, welcome to the deep dive. Today we're looking into hyperbaric oxygen therapy, or HBO, and specifically the potential side effects drawing from the material you sent us.
Right. And like any medical treatment, there's always a balance between the benefits and potential downsides.
Exactly. So the goal here is really to walk you through the key info from the sources on these side effects. We want you to feel properly informed if HBO is something you're thinking about.
Okay, sounds good. Where should we start? Maybe with the pressure effects.
Yeah, let's do that. The material mentions how pressure changes affect air-filled spots in the body, kind of like Boyle's law, but simple.
Right, the basic idea. Pressure goes up, gas volume shrinks. Pressure goes down, gas volume expands. You feel this.
And the most common place people notice this is the ears.
That's it. Middle ear barotrauma. It typically happens when the pressure is increasing inside the chamber.
During compression.
Uh-huh. If that little tube connecting your throat and middle ear, the eustachian tube, doesn't open up properly to, balance things out.
You get that pressure difference across the eardrum, like needing to pop your ears, but maybe it doesn't work.
Exactly. And what that feels like, well, most often it's just ear pain. But the sources say it can lead to fluid, maybe even a bit of bleeding in the middle ear,
Okay.
and very rarely a ruptured eardrum. Doctors have ways to grade how severe it is.
You said it's the most common side effect. How common are we talking?
Well, the numbers reported vary quite a bit, actually. Depends on the study and how they define it. But for conscious patients, it could be anywhere from, say, 9% up to even 50% or so in some reports.
Wow, that's a big range.
It is. And it's much higher, understandably, in patients who are intubated and can't actively clear their ears.
So difficulty clearing your ears is a big risk factor then.
Definitely. That or having previous ear issues. But importantly, the material stresses that actively equalizing, like doing that Valsalva thing where you pinch your nose and gently blow, that's protective.
Got it. So common, but usually manageable with the right techniques. What about more serious pressure problems?
Right, so there's pulmonary barotrauma, lungs. This one's a risk during the decompression phase, when pressure's going down.
The opposite timing to the ear issue?
Exactly. If air gets trapped in the lungs, maybe behind a blockage or an assist, it can expand as the outside pressure drops. That expansion can cause damage.
That sounds serious.
It can be, yes. But the key thing here is that it's very rare. The source material mentioned one study finding only like one case in over 60,000 treatments.
Okay, that's reassuringly rare.
It is. Potential outcomes could be air leaking into the chest,
Maybe.
a collapsed lung, or the most serious, air getting into the bloodstream, and arterial gas embolism. Symptoms might be chest pain, trouble breathing.
And risks for that. Pre-existing lung conditions.
Yes, things like COPD, certain types of asthma, lung cysts. That's why screening beforehand is so vital.
Makes sense. Okay, so that's pressure. What about the oxygen side of things? Breathing 100% oxygen under pressure.
Right, that brings us to oxygen toxicity. One potential issue is central nervous system, or CNS, oxygen toxicity. This can manifest as a seizure.
A seizure. Okay, how often does that happen?
Again, it's a very low incidence event. The studies cited suggest maybe 0.03 to 0.06% of treatments, or looking at patients, maybe 0.3 to 0.6% of patients might experience one.
So very uncommon.
Very. It's basically the body's reaction to those high oxygen levels under pressure.
Are there warning signs? Or does it just happen?
Sometimes, yes. The material lists things like facial twitching, maybe some visual disturbances, nausea, but it also notes it can occur without any warning at all.
And if it happens?
The critical thing is they immediately switch the patient back to breathing normal air, and that stops it. The sources state there usually aren't any lasting effects.
Okay, that's good to know. Any factors increase that tiny risk?
Yes. Things like having acute carbon monoxide poisoning when treated, higher treatment pressures, or maybe a history of seizures or certain brain issues.
Yeah.
And one key preventative measure is using air breaks during the treatment.
Air breaks.
Yeah, just short periods where you breathe regular air instead of the 100% oxygen. Helps reduce the overall oxygen load.
Right. What about eyes? Does the oxygen affect vision?
Yes, the most commonly noted thing is a temporary change in vision, specifically progressive nearsightedness, a myopic shift.
Nearsightedness? How common is that?
It's actually fairly common. Estimated around 60% of patients might experience at least a small change during a course of treatment. It seems to be due to temporary changes in the eye's lens.
Temporary, you said. Does it go back to normal?
Yes, the material confirms it's usually temporary. It tends to resolve on its own, weeks or sometimes months after the treatment stop. And interestingly, how the oxygen is delivered mask versus a hood or the whole chamber seems to play a role.
And what about cataracts? Is that a risk?
The source material suggests developing new cataracts from typical treatment courses, say 20 to 60 sessions, is rare. It seems more linked to really, really long-term cumulative oxygen exposure. But it is possible for existing cataracts to progress a bit.
Okay. Anything else mentioned in the material we should touch on?
A few other points. Claustrophobia can be an issue for some, but it's often manageable with preparation, maybe some reassurance, or occasionally mild medication.
And for patients with diabetes?
Hypoglycemia, low blood sugar is something they monitor. There are protocols to manage it, and the source says actually symptomatic low blood sugar during treatment is pretty low.
Blood pressure.
Can see a temporary, usually mild increase during the treatment itself.
Okay. And one more rare one.
Yes, cardiogenic pulmonary edema. Fluid in the lungs related to the heart. A rare risk, mainly for patients whose heart function is already severely compromised. Again, highlights the need for good screening.
And finally, you mentioned chemo drugs, bleomycin and doxorubicin.
Right. The material clarified that just having a history of using these drugs isn't generally a reason not to have HBO, but using them at the same time as HBO is usually avoided, following specific guidelines.
Got it. So quite a range of potential effects there. It really drives home that understanding these possibilities is crucial when considering any treatment, doesn't it?
Absolutely. And it underscores why careful screening before you start and good monitoring during the sessions are just standard practice. It's all about safety.
And hopefully for you listening, hearing about these things, how likely they are, what to potentially expect, and how they're handled, helps you feel more prepared and confident about it all.
Definitely. It makes you think, when you look at this whole list, from the common ear things that are mostly just annoying, right up to these really serious but very rare events, what does that tell us about the fine line medicine walks, trying to harness powerful effects while keeping things safe?